now we hear from the South Eastern Trust.
My name is Noel Black. I'm the Principal Physiologist at the South Eastern Health and Social Care Trust. Right at the beginning of the pandemic, we needed to put in a novel pathway to improve access, performance, efficacy, and patient and staff safety for ambulatory services. I'm going to show you just a short video clip that ITV had put in place for us at that time to demonstrate this good work that we were about to do.
A drive-through facility that's up and running there to find out as well how other services are likely to change on the ground. It's the health service, but not as we knew it. Here at the Ulster Hospital, patients receive a heart monitor through the window of their car without any need for them to go through these doors.
Yes, whenever the COVID pandemic hit, we had to come up with a strategy to still see our patients. We looked at the heart rhythms, the pulmonary function of our patients, and we need to make sure that we could still see our urgent patients during this very difficult time. So we needed to move from a contact point with our patients through to a non-contact point, but yet still deliver the service.
Hundreds of people have already availed of this cardiac drive-through service.
You go into the hospital and you're sitting there, I wouldn't have had this if I had to go in and sit there, I wouldn't have came. So it is brilliant, and you're not sitting there with everybody else with different sections.
And if you can't make it to the hospital site, equipment is also being driven out to people.
It's brought to the door, and they can continue and get the help they need and the readings they need to help the medical team work out the treatment that they need. It's vital.
It's one sign the NHS is about to dramatically reconfigure again as services start to come back to life.
There were three key successes in the drive-through initiative. The first was the optimal safety for patients and staff, while still delivering maximal essential heart and lung diagnostic service provision during a pandemic. The second was ensuring excellent patient satisfaction and looking for opportunities to enhance patient care while improving access to ambulatory monitoring through co-production. And thirdly, delivery of service provision at optimal levels or above, and the flexibility to deliver increased services for the future. By April 2021, over 4,000 patients have received their monitors safely during the pandemic, including those shielding and in care homes. And there was over 8,000 in-hospital attendances avoided during the pandemic period right up to April, allowing other essential in-hospital tests to be performed safely within our hospital buildings. This created a great opportunity for waiting lists to be reduced during the pandemic. So how did our patients and service users feel about and influence the changes that we made? Well, we received over 700 patient questionnaires. We carried out PDSA cycles, and the comments that we got through that, we reacted to that and made changes. And we learned from the feedback and developed better ways of communicating and delivering our services to our patients. Over 99% of our patients would recommend the service to others. Over 95% thought this was a good alternative to the traditional outpatient appointment. Over 98% stated they were very satisfied or satisfied. And over 99% felt their privacy, dignity, and confidentiality were maintained through this new pathway. We provided clear instructions on troubleshooting from the teams to our patients, and we revised this with our patient feedback. And this was really important that our patients were able to co-produce this with us. We got some wonderful feedback from our patients. They thought we were very well organized. They thought it was a great idea for the drop-off and pick-up points, avoiding going into the main hospital building. They thought it was very easy and well explained the whole way through the procedure. And they thought our staff were wonderful and pleasant at all times. They thought that we should definitely keep this in place after COVID has gone, and they thought it was a first-class service. We used a PDSA cycle to move through each stage, incremental stages through this process. So it was a delivery of service through incremental changes in the way we did things. So we started off slowly and built up with each change and related that back to our patients, and they related their feelings to us. So we collected evidence to show that the quality of the reading was not impacted by the change. And we ensured that the co-production met patient expectation by providing excellent communication and support. This graph demonstrates what happened right at the very outset of the pandemic. We can see here that all services were initially affected very harshly back in April 2020. But because of this service that we put in place, we were able to deliver much higher service than we otherwise would have. What you can see here, then, by the second wave of the pandemic, we were totally resilient to what the pandemic was causing in other services, and we were able to deliver our service at that time. What you can see here in yellow would have been all the service provision we could have provided safely to those staff inside the hospital setting. That meant that all of these patients would not have been able to safely receive their monitors during that pandemic period. So altogether, what we were able to do then was provide to all these patients by setting up this drive-through service to our patients. So the novel change in service made this possible. The drive-through co-production partnership with voluntary services made this workable for our patients and for our service. We can clearly see here from these two graphs that we were able to outstrip the activity that we were even doing before the pandemic. So we were able to bring waiting lists down and make sure that more patients were seen than ever before, even during the pandemic. And this example here of our overnight oximetry demonstrated we went from over 113-week waiting list to now under 6 weeks. So our patients with a restricted disability no longer needed to leave their car to receive or return their monitor. Carers can bring the patient for the appointment or collect and return the monitor for the patient. A face-to-face service is still offered to those who need that one-to-one support. And those who have been shielding have had full access to these essential services throughout the pandemic. So how did our staff feel? Did they feel supported through the change? Did we listen to each other? Well, yes, we had excellent staff satisfaction. We had wonderful and effective leadership within the team at all levels. And we had an open forum for suggestion and learning from each other. 100% of our staff felt that the clinic was very good or good with no changes needed. 100% said they received enough clinical support, and 100% said the new accommodation was suitable, and 100% said the zero contact clinic gave them job satisfaction. It was really important, especially during that pandemic period. Our voluntary services have partnered with us in order to provide a collection and return for these monitors to our patients' own home or care home. This partnership ensures everyone has access to these services, especially our most vulnerable patients. The reliance on ambulance transport has been removed by the effective and truly inspirational partnership with our voluntary services. And we shared the concept with other trusts. The Northern Trust quickly and successfully joined us in this new service model. The Western Trust has followed with a similar design. And we have open dialogue with the British Heart Foundation to share learning and develop these services. So in summary, patient satisfaction delivery of an enhanced patient-focused model was achieved. Optimal safety for patients and staff while still delivering service provision during a pandemic was achieved. And delivery of service provision at optimal levels or above, and the flexibility to deliver increased services now and in the future was achieved, and there's plenty more success to come. Thank you.
Noel, I'm delighted to give you the award for the Innovation and Transformation category in the HSCQI Annual Awards. Very well done.
It's a great award to achieve. I haven't achieved it. The team, our volunteers, our patients have achieved this for the Trust, and thank you for giving us this opportunity. And it's been a long pandemic, but we've managed to change things, make things better for our patients even during that time. So really thank you for this award.
Absolutely, well done.